Hi, my name is David Tenner of the Goldberg Clinic for Chronic Disease Reversal located in Atlanta, Georgia. And today I'd like to present an interview with a patient we've been working with for the past few months. The patient came to see us with postmenopausal symptoms, joint pain, and weight gain. The following interview is a detailed account of the patient's experience with us at the clinic and the significant improvements that she has seen while under our care.
Hello, this is Dr. Paul Goldberg of the Goldberg Clinic. We're here today with Deaconess Kathy Garrison, who has come to see us from, Kathy, where are you from?
We're from Fairfax County, Virginia.
Clifton, Virginia,
to be
exact, yes. And Kathy was going to tell us a little about her experience with the Goldberg Clinic and what she has overcome by coming and being with us and working with a comprehensive program at the Goldberg Clinic. So, Deaconess, what was the original reasons that you came to us from Virginia?
Well, the original reasons had to do with the direction my body was moving. I had a lot of joint pain. I had postmenopausal symptoms that were very uncomfortable. The traditional ones, but they were just a little too intense for too long a period of time. I had lower back pain. I was carrying around too much weight, and nothing I did and would do in a quite a disciplined way, nothing I did worked. So that brought me here. All of that together brought me here.
Okay. And when you came down here, we did a physical exam, we did a case history on you, and some laboratory studies, some functional laboratory studies, and after that we developed a program for you to follow. And in following the program, other than lifestyle changes, nutritional changes, supplemental changes, detoxification program, was there anything exotic or bizarre about what we had you do?
Not at all. It was simple and straightforward. Simple
and straightforward. Would you say, as I don't want to put words in your mouth, well, actually I would like to, but was there anything that we did that was particularly uncomfortable for you in terms of understanding the logic behind it?
Not at all. Not at all. And I was highly motivated because one of the things I did discover from one of those tests in particular was how susceptible I may very quickly have been to some serious pathologies. So that was a high motivating factor. Okay.
So at this point in your life, we've been able to turn your health around somewhat. Let me ask you then, what have been the results of following the program? You've been following it now for how many months, would you say?
Began the eating regimen in early November, I believe it was. And it's now January 10th, 9th. And so for about almost 3 months.
Almost 3 months. And what have been the results? And the things that you suffered with when you came in were joint pains?
The joint pain has been alleviated. I still have some lower back issues, but that's another kind of problem, and I've been able to handle that simply with exercise.
Were the joint pains fairly significant?
The joint pain was fairly significant, yes.
And that includes stiffness as well?
Stiffness of the joints.
And percentage-wise, how much of that has been reduced now?
I'd say 98%.
98%, okay.
Yeah.
And what other issues did you have when you first came down to see us?
The menopausal symptoms have been reduced either to nothing or have been reduced in intensity.
So we've reduced those by 90% or better?
Probably, yes, 90% is probably a good number.
Okay.
The weight has begun to come off, and and that's good because that's improved my movement and my flexibility and all of that. My energy level.
In those 3 months, about how much weight have you lost?
17 as of today.
And when you started, did I tell you I was going to put you on a weight loss program?
No.
No. So this has just come about as a result of getting healthy.
That's right.
Which is what we always do here. We never put people on weight loss programs. We allow the weight to get down to a healthy level all by itself, and that's the way to do it, I believe, because that allows it to not only get level, but to stay at a healthy level after that, other than when people go on weight loss programs and they go up and down, which is very frustrating and not very healthy for the body either. What other improvements, if any? What about your sleep patterns? How have those been?
My sleep patterns have much improved. Other than the odd occasional restless night, I'm sleeping very well. I'm going to sleep quickly. I'm not tossing and turning for an hour or two. And that's a wonderful relief. I'm feeling more rested, and as a result, my energy levels are higher.
And you and I talked a little bit about what I said generically was involved in helping you. What would you say was the main thing that we needed to do to help you get well?
Well, one of the things clearly is the eating less, but that was a simple thing, simply because you've created a program that is so straightforward. I don't have to think about it. It's just there. And so that has been very helpful to me, very easy to do. And it has clearly had a general, very positive effect on me, on my attitude, taking time to just rest and relax and exercise, get some intellectual stimulation here and there. It's been very good all around.
Your work as a deaconess in the church,
Mm-hmm.
would you say that feeling better, looking better, is helpful to you in helping other people?
Very much so, because I always tell people you have to take care of yourself before you can take care of anybody else. And I was really at a place where I needed to do something to take care of me. I was headed down a problematic road physically.
You were on a couple of different prescription drugs at the time.
I was.
You were on some statin agents, is
I was
that
on a
correct?
statin agent. And that's really the only prescription drug I was on when I came here. I had stopped taking hormone therapy before.
Okay.
But the statin drugs,
What did your medical doctor say has happened with your blood work since?
the blood work is very good.
Is very good.
Is very good. He said everything looked great, and that was without statins.
That was without taking any
Without
statin drugs,
statins.
so you're now able to get off the statin
Yes,
drugs.
yes.
Okay.
And I was taking over-the-counter Relief, and I don't need to take that anymore.
Okay. So this is the kind of thing we like to see at the Goldberg Clinic. We're helping people help themselves and turning health care into self-care. Thank you, Deaconess.
Thank you.